Hello students. Now this question is in relation to the middle meningeal artery, which has a big clinical significance. The extradural hemorrhage, mostly which is after the roadside accident, is due to the hemorrhage of this middle meningeal artery. Artery lies outside the dura mater, so that the blood which comes out after laceration of this middle meningeal artery collects superficial to the dura mater, what is called as the subdural hemorrhage. Okay, not subdural, epidural hemorrhage. That means outside, between the bone and the dura mater. Okay, bone and the dura mater. So this artery is of great clinical significance. The question is that describe the meningeal artery. Okay, describe the meningeal artery under following heads: origin of middle meningeal artery, okay, then the course of the middle meningeal artery and the branches, area of supply, and the applied importance. Okay, I have written here, describe the meningeal artery. It should be the middle meningeal artery, because we are specific for the middle meningeal. There are other meningeal arteries unnamed, but here it is the middle meningeal artery to which we are describing. Okay, let us come to the first point, the origin. The origin of the middle meningeal artery is as a branch from the first part of the maxillary artery, and maxillary artery runs in the infratemporal fossa as the terminal branch of the external carotid artery, where just behind the neck of the mandible, this external carotid artery divides into two terminal branches. Okay, forward running is the maxillary artery and upward running is the superficial temporal. So this maxillary artery after its origin then runs towards the infratemporal fossa and lies on the superficial surface of the lateral pterygoid muscle. But as soon as it takes its origin, this in infratemporal fossa, this artery gives this a branch, that is the maxillary artery from its first part gives a branch, what is called as the middle meningeal artery. Okay, and this arises just at the lower border of the lateral pterygoid muscle. Okay, and then it ascends upward toward the foramina spinosum deep to the lateral pterygoid muscle in the infratemporal fossa. At its origin, it is surrounded by the roots of this auriculotemporal nerve. See here, from mandibular posterior division, this roots of the auriculotemporal nerve will arise, and it will encircle the trunk of the middle meningeal artery, and then this auriculotemporal nerve will go towards the temple, and the auricle will supply the sensory branches to the temple, auriculotemporal nerve. So this is that middle meningeal artery, okay, in the infratemporal fossa. It is in the infra. Let us see this diagram, and then I will come to its course again. See here, this is the skull, okay, and here is the middle meningeal artery. This is superimposed on the skull, but it is inside the skull. Okay, just for showing you the relation how it is running deep to the bone. Okay, between dura mater and the bone, this artery runs. So imagine that this artery is not outside the skull, it is deep inside the skull. Just for to show you the course, okay, I have drawn like that. In this diagram, you can also see here, this is seen, the middle cranial fossa is seen. This is the anteroclinite process. This is the lesser wing of the sphenoid. This area is the greater wing of the sphenoid, and between the lesser and greater wing, this is the superior orbital fissure. Okay, now this bone here is the squamous temporal bone, and here is the petrous temporal bone, anterior surface, where is the ganglion is there, that is the trigeminal ganglion in the ganglionic impression near the apex of the petrous temporal bone. It is thus from lesser wing to the superior border of the petrous temporal bone. It is the middle cranial fossa floor which we are seeing from above, in which This is the trigeminal ganglion, which will divide into three branches: ophthalmic, maxillary, and mandibular. And here the branches of ophthalmic, nasociliary, frontal, and lacrimal, they are entering into the orbit through the superior orbital fissure. This is the anterior process, and just medial to this lies the internal carotid artery, and this course of the internal carotid artery is within the cavernous sinus. So is the maxillary and the ophthalmic. Now they are also in the lateral wall of the cavernous sinus. This is the posterior clinoid process. This was anterior. This is the sella turcica here, that depression is there, and this oblique bone going right up to that of the anterior margin of foramina magnum in posterior cranial fossa is the dorsum sali. Okay, this is the petrous temporal, squamous temporal, greater wing of the sphenoid. Foramina ovale, through which is passing mandibular, foramina rotundum, through which passing is the maxillary, and this is superior orbital fissure for the branches of ophthalmic. Now at the angle of the greater wing of the sphenoid, I have written in short, this foramina is there, which is posterolateral to that of the foramina ovale, and this is foramina spinosum, and this is the floor of the middle cranial fossa. This is how this artery, after going through the foramina spinosum, will come on the floor of the middle cranial fossa. Okay, and it is lying on the bone covered by the dura mater. So the artery is extradural, okay, outside the dura mater, but it is just in contact with that of the bones of the middle cranial fossae. The artery will first run laterally and little forward, and this is running it on the squamous temporal bone, where it will divide into two branches: a frontal branch which will cross the squamous temporal bone to come on the greater wing of the sphenoid, and here this is the lesser wing at the angle of the lesser wing of the sphenoid. Okay, this is the second branch, which is called as the parietal branch. This was frontal branch, and parietal branch will run on the squamous temporal bone and ultimately will go on the parietal bone here. That can be seen from outside, superimposition of the artery which lies within the cranial cavity. See here, this is the parietal branch is here, okay, which runs mostly onto the squamous part of the temporal bone, about 4 centimeter above the level of the zygomatic arch, and then it goes towards the postero-inferior angle of this bone, that is the parietal bone, where it divides into many branches. This is the frontal branch, and the frontal branch here, it lies deep to a circular area which is enclosing the frontal bone, the antero-inferior angle of the parietal bone, the greater wing of the sphenoid, and the squamous temporal bone. And enclosing all these four bones here is an area what is called as the pterion. So this artery grooves on the deeper surface of this pterion area, okay. But you should remember that while these frontal or parietal branches, they are running onto the inner aspect of the skull bones, okay, the superficial to these artery branches lies the middle meningeal vein. That means vein is in direct contact with the bone, okay, of the skull, and this artery is away, but still both the vein and artery, they just form the groove. Okay, try to see these grooves on the base of the in the floor of the middle cranial fossa, and you will see that with the help of groove you can see the direction of the parietal and the frontal branches. Important is this pterion area. Here is the junctional point of the frontal bone, antero-inferior angle of the parietal bone, then it is the squamous bone and the upper end of the greater wing of the sphenoid. And this is that pterion. And importance is that the middle meningeal frontal branch, it grooves the inner surface of this pterion area, okay, pterion area. I hope that you have got the idea about these diagrams, and let's come back to the course. Okay, course. As artery enters into the middle cranial fossa through foramina spinosum, then it will run onto the squamous part of the temporal bone. So from foramina spinosum, it is running onto the, this is squamous temporal bone. So onto the squamous part of the temporal bone, okay, after the foramina spinosum, okay, and this is on the floor of the middle cranial fossa. Then it runs between, as I said already, that it runs between the endosteal and the meningeal layer of the dura mater. Dura is having two layers. The outermost is the endosteal because it forms the periosteal covering of the inner aspect of the skull bones. All those greater wing, the frontal bone, the parietal bone, and the squamous part of the temporal bone. And then there is a second layer which is towards the cranial cavity, and it is called as meningeal. So between these two layers of the dura mater, this artery is running, okay, but it is said to be extradural because it lies outside the meningeal layer of the dura, okay. Now, as I said that this all the branches in the main trunk of the middle meningeal artery, as it lies on the floor of the middle cranial fossa, it is in relation, superficially it is in relation to the meningeal vein. That you should not forget, okay. So the artery is not in direct contact with that of the bone. There is a vein which is direct contact with that of the bone is there, okay, but it doesn't make any difference. But this is just a relationship between of artery and vein to that the grooves which are present in the floor of the middle cranial fossa. I hope that you have seen the origin, you have seen that the course of this artery and its branches, okay. Now this, the parietal branch, it will go to the antero-inferior angle of this parietal bone where it will divide. Some of its branches will go towards the lambda, that is the junctional point between the sagittal suture and the lambdoid suture. This artery will go right up to the lambda, okay, and as I said that this branch is above the zygomatic arch, and this branch I have just drawn a little posteriorly, but it will go like this, where it is in contact with that of the, I mean to say, with the motor area, premotor area and motor area, that is area number 4 in front of the central sulcus, in front of the, that is the frontal branch, okay. Now let us come to the branches. Branches, as I said, there are two branches. This is the frontal branch and this is the parietal branch, okay, which they arise at the, in the middle cranial fossa in relation to the squamous temporal bone. Now if you see the frontal branch, okay, frontal is also sometimes called as anterior and parietal is sometimes called as posterior branch, but the frontal branch runs forwards and upwards. See this, it is running forwards and upwards, and then this lies deep to the pterion. This lies deep. This is very important relation of the frontal branch of the middle cranial fossa. Surgical importance is attached to this area, okay. Pterion, it is lying deep to the pterion in a groove, okay, because wherever these branches are going, they are causing the groove on the inner aspect of the skull bone, okay. Then this it runs onto the parietal bone. After this pterion, the artery runs onto the parietal bone about 1 centimeter behind the coronal suture. To begin with, it is about 1 centimeter, okay, behind the coronal suture and divide into many branch deep to the parietal bone. It will divide into many branch, right? So this was the frontal branch. Let us come to see the parietal branch, okay. The parietal branch first run upward. See, this parietal branch first will run upward and then immediately it will go backward onto the squamous temporal bone. This area is of the squamous part of the temporal bone, and then this artery will cross this suture, okay, squamosal suture between the parietal and the squamous part of temporal, and then will go to run onto the parietal bone itself. That's why this is ultimately called as the parietal branch, okay, and will go towards the lambda. It will go. Now these two branches, that is the frontal branch and parietal branch, They are the branch mainly to supply the dura. That's why they are called as the middle meningeal branches. Okay, branches from the middle meningeal. So the middle meningeal artery, in true sense, it is the artery to supply the dura mater. So number one supply of this is area of the supply is to the dura mater, both the meningeal and the periosteal branch. But this will also supply to the skull bone, the diploe, that is the spongy bone between the two layers of the compact bone. Okay, so this will also supply to the bone, it will supply to the dura mater, and this will also send branches, minute branches, okay, to the trigeminal ganglion. So the trigeminal ganglion, which is here on the anterior surface of the petrous temporal bone near its apex, okay, part of which is within the cavernous sinus, is supplied by the branches from the middle meningeal artery, trunk of the middle meningeal artery. It will be supplying to that of the trigeminal ganglion. Then this artery will send the minute branch here to the greater superficial petrosal, hiatus for the greater superficial petrosal nerve, which lies on the anterior surface of the petrous temporal bone. So artery will go inside and the nerve, the greater petrosal nerve will come outside. So this is an artery which is going inside the middle ear cavity. Okay, so it will supply to the structures in the middle ear cavity. Okay, and then middle ear cavity, important is tensor tympani. Then there are the veins. It is followed by the veins. Okay, all these branches and main trunk in the floor of the middle cranial fossa, it is followed by the vein, which we said that they are called as the middle meningeal vein. And this middle meningeal vein will drain to the cavernous sinus. As I said that cavernous sinus is here. This is the area for the cavernous sinus here, and the vein which will come, the main trunk will go into the cavernous sinus. Okay, so it will drain the blood into the cavernous sinus without coming outside the cranial cavity. It will go and drain into the cavernous sinus. Okay, let us come now to the applied anatomy of this artery, middle meningeal artery. Now, as I said that this middle meningeal artery is of great importance for surgeons because, okay, frequently this artery gets rupture while it is passing deep to the terion. That means the frontal branch will get rupture while it is going deep to the terion, and there will be the collection of the blood because of the rupture. Okay, the bone may also go fractures, and with this fracture of the bones, okay, in the region of terion, the artery will rupture. As I said that this artery is running between two layers of the dura, meningeal and endosteal layer. So the blood will collect in between these two layers. You can say that it is outside the dura and deep to the bones. Okay, deep. This is called as the extradural hematoma. This will form a hematoma, means the collection of the blood which will become, clot, and this will form a collection of the blood, okay, outside the meningeal layer of the dura mater. Okay, extradural hemorrhage. Okay, so this is called as the extradural hemorrhage. That means it is not going inside the cranial cavity, it is lying between the bone and that of the dura mater. Okay, but then if the bleeding keeps on going, and if it is an excessive bleeding because artery is quite big, then the hematoma or the blood collection, okay, between the bone and the dura will keep on accumulating. Okay, and since the bone cannot be pressed because of this collection, ultimately pressure will go towards the brain. Okay, deep, okay, towards the brain, though it is the extradural in nature. And as I said that the frontal branch ascend up in front of the central sulcus, that means very close to that of the motor area number 4, a compression onto this area because of the excessive bleeding will lead to the paralysis of the motor failure. Okay, motor area will be under the pressure, and this will lead to the paralysis of the opposite side, because the fibers arising from this area number 4 or the which lies in front of the central sulcus is a motor area, and this motor area will get compressed and there will be the paralysis of the opposite, because the fibers arising from the motor area precentral gyrus, they cross to the opposite side, okay, in the medulla, pyramidal decussation. So they will supply the muscles of the opposite side, okay. So this may lead, hence the surgery become very important and very quick surgery is needed, and the surgeon will remove this hematoma or collection of the blood from extradural space, okay, and then the person will become all right. When you will take an X-ray or CT scan of this, you can see that there is a collection of the blood and the brain. If it is excessive collection, brain is shifted to the opposite side, the brain, okay, because it pushes the brain to opposite side, okay. So this is an applied importance, most important applied importance in relation to that of the extradural hemorrhage due to the middle meningeal artery rupture. Middle meningeal artery rupture. Okay, I think this completes the applied anatomy and the middle meningeal artery, its course, its branches, area supply, and the applied anatomy. Thank you very much for watching this short video.